Hello, my name is Brooke and I work in the informatics department at Memorial Hospital of Sweetwater County. And today I'm going to be going over a brief demonstration of our Quadramed system for minimal use, such as consultations, just simply reviewing patient information, etc. So what we have here is our main desktop. And when you log into Quadramed, it'll take you to your main desktop. And we know that because of this big house here. Big house, big picture, and it says main desktop right underneath there. The main desktop will take you directly into your inbox across patients and have any patients listed here if they've been assigned to you. The patients can be assigned to you via our affinity registration system, via provider assignment, or from another physician. So right now, I am logged in as Dr. Symington, who is an oncologist in our clinic. And she does consults on patients when needed in the hospital. And the process for that is our hospitalist or provider will give her a call, and she will do her consult on the patient in the hospital and either dictate that note, or she may do a direct entry on a consult note. So let's start with how we get to our patients and patient search. So as we can see here, we have a patient search option. I click on that. It defaults to all patients. So what we do here is use these keys and open these options, which are filtering. So if I just wanted an active patient that's inpatient or short stay or emergency, I could simply choose the different options here listed, and discharge patients, etc. So if I just choose to do our active patients here, the way we can search in Quadramed is via the medical record number, which is going to be a 9 number, a visit number, which is going to have a V in front of it and a 080 number, or we can do last name, comma, first name. And as we can imagine, last name, comma, first name for John Smith or Sally Smith is going to get quite large. So we advise you to do the medical record or the visit. Okay, so those are some ways you can search here. Also, if we close out of that icon, you can search via the unit display. So if this patient's on medical floor or on the ICU floor, you can sift through the unit displays. And the computer that's in the unit that you are using will display to that unit, so it will default to medical floor if you are on medical floor. Discharge patient, same thing. Another way you can search for patients is, let's say you are going to do a consult. We can search via provider assignment and assign ourselves that patient. So I just clicked on that provider assignment, and I'm going to use a dash to search patients because in Quadramed, a dash is a wildcard, so it opens up a greater domain. So I'm going to do a dash and enter, and this has given us all our patients in our Quadramed dev environment. So if you were to do this in live, it'd be quite a large list. So I'm going to go ahead and just choose one of these patients because I want to consult on them. So as we can see, we have our name, location. This is the medical record number, which is the 8 in our test environment, but it'll be a 9 in live. And then our visit number is that 8 number, our sex, age, and position. So let's go ahead and I'm going to choose after role here by double clicking. And as we can see, we have Dr. Croft is the attending, and I'm just going to do a consult. So what I'm going to do is simply click here on number 2, or I could use number 2 in my keyboard. I'm going to choose at A down here, because in Quadramed, when you're looking for add information here, it's the transaction line down here that's telling you what to do. So always pay attention to this transaction line. So I'm going to choose A, or I could simply click on this button and add, and then my name should default here as a consulting physician. I'm going to choose OK, and this is just showing me that consulting physician name. If I needed to add more, I could simply do that or modify it. And OK one more time. And as we can see, we have the attending, and now we have Dr. Symington as a consult. OK, one more time to get to our accept button. In Quadramed, if you don't get to the accept button, it never happens. So please reach out to informatics if that is the case, so we can help you get there. So I'm going to choose accept here. Now Let me close out of this provider assignment, but before I do, every time you click on something in Quadramed, let's say we're going to choose the patient search, or we were going to choose other buttons available at the patient level, they're going to list here, so feel free to close these out so you don't get lost by just simply hitting on the X there. Okay, so now we should see this patient here listed because we have assigned them to ourselves as a consulting physician. So I'm going to simply choose to refresh here. And now we can see that we have that patient after role in there, okay? Notice here, we also have our inbox across patients on this level and our signed dictation. And that's for the dictations that will come in via interface that you would dictate by phone. But before we go into these sign review and inbox, let's go ahead and take a look at one of these patients. So I can show you how to look up information and potentially do a direct entry consult note. All right, so let's do alcohol detox here. I'm just going to double click on this patient, and now we're at the patient level. Now notice we still have this big house up here, big house, big picture, but we also have this patient listed here, and that little house there and this little guy, we call it, is the patient level. So next to this little house, we have the patient identifiers. This cautions triangle is going to show you any kind of allergies or precautions that need taken if they've been documented by the staff. And on this patient level, we see that we have our provider inbox here as well, and we could certainly go in and sign these orders if they were, if we wanted to do that at this level. But again, I'm going to take you back out to the main desktop to look at your inbox across patients to do so. A couple ways you can look at information here. We have our chart review option. Chart review is a filing system of information that's been documented and or scheduled. So you could do all chart review, you could go to physician, information, surgery, and the grayed out options, it means there's no information there. So you wouldn't find that information in there. So let's say we wanted to take a look at laboratory, and as we can see, these are all scheduled options for these labs. However, I'm going to take you to a different patient real quick because I want to show you some trending options with those labs. And this patient is, if I go back out to my main desktop, I'm just going to do a unit display search. And I want to go to surgeon train, I believe, double click on that patient. And now we see that we've got two different patients open and a unit display open because I accessed both of those items. We go to chart review on surgeon train, and we go down to laboratory. Now we can see that we have a couple of BMPs here, and we can see that the date and time and the fact that they're completed, but we have an abnormal and critical here. So our transaction line is asking us what we'd like to do with this. I'm just going to double click on them, and that opens these up for me, and I can see the values there. I can also look at this transaction line here to see if I wanted to just go ahead and go to this next event by clicking there. That'll take me to the next lab, or I could simply do a trend here as well. So if I choose trend, this is going to pull in the BMPs as they have been resulted on this patient. So the trend option is a good idea in case you want to look at a progression over time or trend. And to get back through this chart review, I can simply hit OK or back, and it's just going to take me through the screens I just went through. Another quick way to search in chart review is procedure, and I just simply clicked on that procedure button. Now I'm going to choose dash, basic dash, because again, those wildcards will open up a bigger domain. So now this system is going to look for any procedures that was done with this word basic in there. And I'm going to hit OK. And as you can see, it pulls up those procedures that have that basic. And I can simply double click there, and it takes me back to those BMPs. So that's another quick way to navigate through chart review quickly. If we look at anything physician on this patient, generally physicians will do a dictation summary or direct entry note. So to look at these, we can simply double click on them. And as we can see, we have a VTE assessment and provider direct entry note. If I wanted to read that, I simply double click there, And this is not a very pretty way of reading anything. So if we look again at our transaction line, we have this report query option. If I choose that, it's going to bring me up more of a Word document. And then when this was partialed or completed, and then whomever may have looked at this note. So this is a better way to read those kind of reports. Okay, again, that was just report query. Now, let's go ahead and go back to our alcohol detox. So I'm just going to simply close that patient, and I'm going to close this, and I'm going to choose to click back this alcohol detox. Another way to look at quick information in a trend view is this vital signs trend or orthostatics. If those were something you wanted to take a look at, they would be listed here. Order management is where orders get placed. In order to do that, you have to have a problem. And generally, when you're consulting on a patient, you would add any orders to the diagnosis that's active, and or communicate with the provider on which orders that you would like. Provider assignment, that's what we did at that main desktop level. So we can see that that has been done, and we can do that at the patient level or the main desktop. Now, again, look, we're getting all this stuff piling down here, so I'm going to simply close those items just by hitting those X's. Now let's go to direct entry notes. Direct entry notes is essentially that. If you're not going to dictate, you can use the direct entry notes. Pay attention to specialties here. We have medicine, surgery, anesthesia, pediatrics, nephrology, direct entry. So if you were to do a consultation note and it was just a generic, you could simply grab that consultation note here by double clicking on it. It's going to ask you for the date and time that was performed. I'm going to go ahead and allow now. But if I did do it 30 minutes ago, I could put the date of 11/5/2020 space 0800, and that would give me 30 minutes ago. So let's just practice that for, let's practice that just for demonstration purposes. And then I'm going to put 0800, not 8,000, 0800. Okay. And now what it's going to do, I just hit enter. It's going to bring up this Word document. And I start typing away. And I can choose to save or close as you would in Word, but either way, it's going to ask you if you'd like to save it, because we've developed a new one. So I'm going to hit OK. These won't happen in the prod environment, so don't worry about that. But now it's going to upload that Word document into Quadramed. And again, once we have gotten to this accept button, we have arrived. So you can choose to accept that there. Okay, now we can go into chart review, and that progress note will, that consult will be in there, right there. Okay, all right, close chart review. A lot of you'll be spending majority of your time under these patient shortcuts with these options. However, you can also take a look at this ICG, which is our interactive care grid. Green is good. If I were to go back to the patient that we looked at before, which was surgeon train, double click on that patient. And look, we have this alcohol detox, surgeon train. If I click on this ICG here, we see green is good. Red is critical, which is underlined red and bolded with the exclamation. And we also have our triangle down here, which is abnormal. And abnormal is just bolded and underlined. And to take a look deeper into these, we can simply double click on them, and that'll take us into that documentation there to look at that critical. Okay, another quick way to look at information, data review. This shows you maybe nicknames or a quick view of the height and weight, allergies. Pharmacy information can be found here, and of course these latest labs documented here. This order list is going to tell you what is active right now, but it can be filtered. to include all orders, not just active, and then you can do by Cardex group. Modifying that there. Growth charts is simply that. Well, feel free to use those. And a wound ICG, if a patient comes in and has received wound care over time, you can see that progression with this wound ICG. Now let's go back to our main desktop, and I'm just going to simply close these and this unit display option here, and we're back to our main desktop. Now to take a look at any kind of orders that you have maybe given verbally on a patient, you can do that via this inbox across patients, and that'll take you into critical abnormals to review, other results to review, maybe any orders you have given verbally, via or telephone, your ASOs, any results that need to be completed. Results to sign is going to include your dictation and then delinquencies based on time. So look at all the patients. You can go down to this total, and this will list out any of the patients that you have assigned to you. And then when you go into these orders, we advise that you double click on them and actually go into this information. So it shows you if there's any comments or who placed the nurse, who reviewed it, placed the order, reviewed it. So please go ahead and do that there. And then you can sign that order or not sign it, reject, discontinue, that sort of thing. So this is the inbox across patients in which you can sign those. If you have something open that is looking for a signature, accept button, or something similar, this will give you a warning so you can go ahead and find that documentation before you lose it. So I'm going to choose yes because I did not sign this. Going back into our inbox across patients. Now, if I were to just click on one of these, it's just going to show me the one patient that has that medication order that I need to sign. Notice down here as well, once I click on this one, it gives me the options to go straight into the visit, edit it, select it, and sign review. But if you sign a review here, you can't really see what that order says. So we always advise you to go in and see what that order says before you sign it. And then we were going to go to our dictation. We could go simply through that inbox across patients or the signed dictation here, in which they would list once they come through the interface, and you can make modifications or edits as needed. And upon training, we will absolutely show you how to do that. All right, so we've gone over our main desktop, the patient level, and how to find information, how to search for patients, how to sign off on orders in our inbox. And now we can go through the rest of these buttons. This intranet will be a direct link to our hospital intranet. This email option doesn't really do much. It does not go to your email, so it's not set up that way. Feel free to use the calculator BROMs if needed. This log off button here is essential every time you log off, so you don't get your session hung up. And then this mail option here may turn red if there is anything that needs to be communicated in the system, such as suspected sepsis, etc. So once you open that mail, it will give you that patient information and it'll turn red. And I hope that was helpful. Again, always log off properly using this log off key. Thank you.